Hello everybody, this is Dr. Pierre Brunet. Today we're going to talk about a hip flexor stretch. One of the best ways to stretch the hip flexor is to go into an inline lunge. The hip flexor compromises of the iliacus, pectinus, psoas major minor. There's other muscles that flexes the hip as well that crosses multiple joints, such as the Sartorius and the rectus femoris. For the purpose of this video today, we're going to focus on the psoas. The psoas starts from T12 vertebral body all the way down into the L5 vertebral body, and it goes and inserts right into the lesser trochanter of your femur. So it starts from the spine, and when it contracts, it lifts the hip up where you have hip flexion. So to get started with this stretch, you're going to go into a fencer stance position. The side that you're stretching, the knee is going to be down. Your back is going to be as straight as possible throughout the stretch. Remember, this muscle starts from the spine. Head up, chest up, and you're actually going to lift your toes up like this. Perfect. And you can slowly ease into the stretch and feel the stretch on the knee that's going down, on the leg that the knee's going down. Okay, and come on up and relax. Perfect. So progression number one, to challenge the stretch a little bit more, you can put the opposite hand on the knee and push down, and you can contract the gluteus maximus. By contracting the glute, the opposite muscle from the hip flexor, you have that agonist-antagonist relationship, and this reciprocal inhibition relaxes the hip flexor a little bit more. Good, and you can relax. Progression number two, to increase the challenge again, is you can go into progression number one, like so, and you can lift the same side arm up like you have a question in class. This is based on Thomas Meyer's anatomy trains, where he looks at myofascial lines. We're focusing on the deep frontal line and the superficial frontal line. Good, and you can relax. To get into another progression, to increase the challenge again, you can go into the stretch again, and I'm going to grab your foot, and you can grab a band and pull the leg all the way up to engage other muscles that we talked about previously. And you can relax. The reps, the sets, and the time are all going to be discussed in clinic. And as usual, if you have any questions, please feel free to reach out or go on my website. Thanks for watching.